What's up, everyone? It's Dr. Glenn Vo. I am super excited to be shooting this podcast live at the CDA. And I got a specialist, but not just any specialist. It's Ron Fortier, the SEO specialist, the director of SEO at Dr. Genius. You don't have to be a genius to work with them, but there is a lot of geniuses that work there, and that Ron's one of them. It's Ron Fortier. Ron, welcome to the show.
Thank you. Great to be here.
So when I was talking to Al, he was like, dude, I got the man when it comes to SEO on the show. And so I've been excited to meet you. Okay, so before we get into things, how did you get started with Dr. Genius here?
I was in automotive SEO for about 5 years. That company went down, laid off, so sent out a bunch of emails, and actually it was Al that responded going like, hey.
Oh, wow. Now,
so very similar but different.
We gotta take a step back here.
Right.
So you're an expert at SEO, but you were in automotive SEO?
Automotive SEO.
So is that like for a dealership or something?
We had about 3,000 dealerships nationwide. So it was different than dental SEO in that you ranked inventory, but it was local businesses. So again, kind of that same local SEO concept of how do you rank, pages and category pages and things like that. So it was a direct translation into what I'm doing.
So, whether you're dealing with cars or you're dealing with team, SEO is SEO, right? You got to fine tune it to the and whatnot.
Exactly. So if you think of Tom Brady, the best quarterback of all time, if you had him as a running back, it would be worse, right? And that's the key is you need to understand kind of the business and the client or the searcher that you're trying to reach. Right. It's very different if I'm looking for, product, Ray-Ban sunglasses versus healthcare, right? One is a lean back experience. So if I'm looking at Nike shoes or Ray-Bans, it's very lean back. If I'm looking through my thread or whatever, but healthcare is very lean forward because I need, either an optional service or, I need a root canal now, man. There's this tooth in my head that I just want out.
And that's super important. Like, I want everyone to know, and the reason why I'm so excited to have Ron on today is he's the expert. He's the SEO specialist for Dr. Genius. Dr. Genius, they do all sorts of marketing, but SEO is really important to them. Again, Ron's been in this industry for a while. And we want to talk about dental SEO, right? Now, you guys probably don't even realize this, that there's different types of SEO because, it's really focused on some particular niche. So for those who are watching right now, they're saying, Wix website or any of these guys, and maybe I'll go into Fiverr or maybe I'll find someone and they're an SEO specialist to do SEO. Well, it's almost like saying I'm a beginning. I can work on cars. Well, what kind of car? I can work on domestics. Yeah, but I have a Ford.
Right.
And it's like, it's still cars, but it's still different there. Explain to everyone the difference, the nuance here with dental SEO as opposed to regular SEO.
Right. So regular SEO, say I'm a hotel in Orlando, right? Yeah. Every single day, 10,000 people are going to look to book a trip to Orlando. It's a very different thing than, I need a root canal. I need believe it or not, tooth extraction is very, very popular. So people have an immediate need. Now the other thing is similar to automotive SEO, when you're in market for dental needs, you're not going to need another root canal next week. Right. When you're in market, you're going to purchase right now. So there is an aspect of direct marketing to it as well.
Yeah, that's super important. And also, when we talk about dental SEO, you brought up an extraction, right?
Right.
And there's other procedures too.
Sure.
But look, if you have a dental emergency, you're not going to be fiddling around and becoming like a researcher and trying to look for anything. You want something quick.
You want it.
So again, for those who are thinking about I'm not sure if this is that, or right? I got a Google listing or something like that.
Right.
Well, when someone is searching for something, why is it so important where you have to give the keywords optimize? Because that's going to bring them to your site.
Well, and it comes back to content, right? how do you rank for a keyword that's not on your website? So if you only have 20 pages on your website, how are you going to rank for all of those subtleties? So for us, I think we have about 285,000 pages on our standard dental deploy across 150 to 170 pages, right? So you as a dentist, you may not provide a series of services, so we're not going to deploy those for you, right? And so technically you can say, yeah, somebody can do SEO for you, but what, is critically important is when we do a deploy, say those 150 pages, whatever, 50 pages are not needed because you don't do those services. Well, that would, and just say an average of 10 inbound pages or in links, you'd have 500 links that would 404. So now you need to edit it. So there's so much stuff that goes on behind the scenes. So you can say SEO, yeah, I can go update a couple of pages, but the volume of what we do, I think we've got 2,000 FAQs on the site. So critically important. Content is.
And I think that's something that people don't realize, right? That they're like, okay, well, hey, I can get a website on books.
I can write. I can do it myself.
I mean,
but are you going to write 150 pages with 1,800 words? At what point do you give up?
And you think about it this way. I mean, for the doctors that are like to do it yourself, and that's fun, right? We're not hating on that. I mean, a website is better than no website,
right?
Right? A website is better than no website,
right?
Some SEO is better than no SEO. But if you think about it, if you make the bulk of your money with your two hands working in dentistry, wouldn't it make more sense to focus on that instead of constantly updating a site? Because again, what you guys do, you don't just do with SEO and just leave it for the rest of the year.
It's ongoing, and it's key. Again, going back to the content, is you think of the pages that we create on behalf of the clients, right? We have a 130-page style guide that tells the writers how to write, how to communicate, where to put things. So if you look at one of our standard dental service pages, right, we understand that people consume content in different ways. So maybe you're a reader. So we provide paragraph content. Maybe you don't like to read, so we pull out pull quotes. So you just read the pull quotes. Maybe you are a headline skimmer. So we have a series of headlines so you can understand the page and consume it that way. Lower down the page, we have FAQs because you may want it in question and answer format. And at the end of the page, we have a series of definitions, which kind of tie in. So it's like, again, if you've told me as my doctor or my dentist, I need this procedure, I may want to go back and research that. And you may use a term and I'm like, hey, what is that term? So we don't only want to come up for dental crown, we want to come up for a variety of things that kind of enhance those searches.
And again, you just laid out a bunch of work there that I don't know, like the average dentist even has time to even do what you just mentioned there. Now, again, multiply that by all the procedures that we do.
Yes.
Now add into the fact that you're in a particular town, different geography, stuff like that. So for those who are, they're listening, they're like, okay, I understand, but I don't know. I'm already working with self.
Right.
How can I evaluate what I have here? Other than, of course, just to let you guys know, they always have like a free consultation to talk. Al, it is amazing to talk to. He has already said that he's willing to talk to anyone. There's no charge or anything like that. But outside of reaching out to the guys, if someone wanted to do like a self-audit, like I want to look at my site, or maybe I'm working with someone, I want to see if they say what are some of the things that they should be looking.
So the first thing that I would do is most sites, when you type the URL, whatever it is, .com, do a /sitemap.xml, because then you're going to see, because we have many competitors that try and sell against us, right? And we had one that left, and they went from 150, 175 pages down to 8. So if you look at your sitemap, you're immediately going to be able to see how many pages they have posted on your behalf, how many blog posts that they posted on your behalf.
Let's use you guys as a standard. How many pages do you guys normally do?
So again, it depends on the services. If you do all of them, I think it's upwards of 175.
So if someone
and then that's just the pages, right?
Yeah.
So then we have regular blogging, because the thing is Google rewards effort, right? Yeah. If you just deploy a site and you leave it, it's like, I don't care about it, why should they, sort of thing. So
it's kind of like if you have a garden, right? And you set up the garden, it's really nice, and you never took care of it again.
Right.
it's going to fall apart.
Yeah.
When you say like websites, it's the same.
Very much so. And same pay-per-click, if you stop paying, everything goes away, where SEO will stay, content will stay. It has a lasting effect. Another key important technology Dre and his team added, which is if you go to a blog post, in any blog post page on any site, you'll see the most recent blog posts. But what we do is we tie in, so cosmetic dentistry goes, if you're on a cosmetic dentistry, it only pulls the cosmetic dentistry related blog posts. So it makes it so much more relevant to a consumer and to Google, right?
You get rid of all the extraneous info that like, if I want an emergency, I want to know what you're doing. I want to see
the emergency related content. You don't want to see teeth whitening. Exactly. Right. So context is huge, I think. Yeah. Right. So the ability to have that, and then Google sees, again, those pages are being updated through time with contextually relevant information. So,
a lot of times people always think, and you work with a lot of dental professionals. Obviously you guys work with dentists and understand like how we operate. A lot of times dentists will come in and say, okay, I need this SEO. I need to rank like the top. I need it like right now. Let's properly set expectations for our audience. So for those who are, they're thinking, or they hear from other people like, oh yeah, dude, yeah, we'll get you on the top right away.
Right.
Let's properly set expectations there. So
it's not a light switch. But the key is the content deploy that goes up, right? You're not going to rank for dentists all of a sudden, because in the same way, I'm a Dodger fan. If I started having a blog about the Dodgers, like how am I going to rank relative to the people at ESPN that's been writing about it for years, right? But that's not to say that I won't be found in search. And that's where the complexity of the page comes in and is very important, because I will get long tail search terms. I may not get that head. I may not get dental crowns, dental implants, dental veneers, but some question. Again, if we have 2,000 questions on our website related to the topics, I think it's 116 questions alone on dental implants, right? Chances are you're going to get something, and it's, you're going to hit. Well, even out of the gate, you're not going to be number one. You're not going to get, thousands of visitors, but you are going to get those ones. And
it really depends on what the keyword. Again, speaking of the Dodgers, if you were talking about Herschel's favorite barbecue place in Dallas, if someone searches for that and you happen to have the page,
yes,
you rank right that.
And even though that's your first blog ever. Exactly.
That's again, if it's a doctor, especially I want you guys to understand this. For those who are practicing and specialize in something very niche in dentistry, there's a huge opportunity in here.
Right.
Like maybe you're like one of one that does TMJ in Fayetteville, Arkansas or something like that, and you write a blog there. I think that's the working with someone, like him who understands how that works, and also highlighting what you do. Again, yes, if it's dentist, there's a bunch of dentists.
Right.
But maybe you're a dentist who, I don't know, is the team dentist for the Dodgers. I know who the team dentist for the Dodgers is.
But it's not even that. Again, it's just the notion of, okay, you deploy those pages. Now, all of a sudden, we're going to blog for you. So we have, remember paper mache where it used to, so it's that same sort of thing. You're just constructing something by, because every blog's going to have a different topic. So now all of a sudden your site's going to be different, relative to that topic. So you have the opportunity to show up in search.
So we understand that we properly set that expectation that, it's a work in progress, just like anything that's in there. But as more work you put into it, the more consistent you are, you slowly climb the ranks. But other people are kind of being lazy, or maybe they were working with someone who is not really doing what they're doing. You're slowly going to climb ahead of them just give a range. I know it's really hard. And I know that's something that you guys kind of stay away from, because it really depends on where you're at, right? If you're in Dallas, Texas, or if you're in Corpus Christi, or if you're in LA, or if you're in Rancho Cucamonga or something like that, right? It really depends, but generally, how long does it take for people to really kind of see there's some traction? What would you say?
I say it's just a matter of months, handful of months.
Okay.
So, I mean, we have one where a new technology we deployed. I monitor it on a daily basis, and you'll see the traffic coming in, right? But again, it's for a variety of terms, and
And again, it really depends on your practice too. What's unique? I mean, I always tell dentists, like, look, I mean, there's a dentist for everybody. There's some people who only want to see female dentists. Some people only want to see female dentists who have kids, right? They want to bring their kids there, or it could be a variety of reasons. But that's why it's super important to work with someone like Dr. Genius who understands the differences and understands how to take advantage of those differences there. Okay, so we're going to switch gears here really quick, and I always like to kind of play this game. It's called like true or false, right? So let's talk about the false things that are out there, the myths when it comes to SEO, because there's a lot. What are some of those things where people are like, okay, you hear it all the time, you're like, dude, it's totally not true when it comes to SEO. What are a couple of things that
I mean, the one that comes to mind is the length of registration for your URL and things like that. So at one point, I believe it was GoDaddy needed to increase their revenue. So they put out blog posts that Google used it as a ranking factor, how long you registered, so people would go in there and say, I want to not re-register for a year. I want to do 5 years because it shows I'm committed.
Yeah.
So there are things like that.
Is that true?
No, I've never seen it. And that's where, sometimes when practices move or change hands or, there's a lot of concern relative to picking a new URL. And my preference is to change it, but monitor it. And then if there's an issue, we can deal with it. But, and it's never come back to me, but that's always one where it's like, do we change the name? Because it used to be the old doctor's name or something like that. And, or new practice or things like that. So
this is the big one. This is the one that a lot of people are always not sure about. That is the length of your blog post. Is the length of blog post, is that going to affect your sales? Is it 300 words? Is it 500 words? Is it 2,000 words? What is the length? And does that even?
So yes, it very much matters, right? So I think that 300 words is too short. And the issue is it goes back to
like a few paragraphs.
Yeah. What are you talking about? How in depth can you get? Right. So if it's totally superficial, then I just don't think, 2,000 words. Certainly our service pages are upwards of 2,000 words because we want to have kind of those aspects, those different aspects. But I think a blog is a little bit more consumable. So I would not go. I mean, you can go 2,000 words if there's something that you really want to go deep on, but I'm not sure that I would do that.
Do you, but for your clients, do you support or do you kind of discourage the doctors writing their blogs?
I would support.
Okay.
Absolutely.
And again,
because the thing is more that we know about you, right? What is special about you? Is there a business in your area that you can cater to?
The more the better.
I want to say there was one near Microsoft where they had a really great dental plan. But just imagine, it's like, here are the things that you can do with your dental plan. Why are you not, taking advantage of this? So I would definitely do that. I would definitely do video. It's hard to do, multi-minute video into camera. Professionals have problems with that. But doing a little 15 to 20 second thing that shows your personality. I know my wife and daughters wanted a female dentist. And the thing that picked, when we were forced to pick, the thing that did it is she had a video. And I was able to go, here's the dentist that we're going to, right? Do you feel comfortable? Yes, green light. And it doesn't have to be 2 minutes. It just has to show who you are. And if you think of from Google's standpoint, all of a sudden, the more transparent that you are in who you are and where you went to school and things like that, I think that's all good. And maybe your personal approach. I do this a little different. Why not? Yeah.
So, for those who are watching, they're like, okay, I want to see how, we can work with Dr. G's. Before we talk, of course, we got a nifty deal, guys. Before we even get to that, but I am going to ask, how does the process normally work? Like, obviously, I know that they would talk about how and whatnot. I mean, is there
With sales,
how does that?
I think that they have a conversation, and I think sales goes in and does research before a call to make it valuable, right? And says, here's the situation that we're seeing here, and here's why we think that we can help.
Right, easy enough. Okay, so I can't let you get away without talking about the deal here. Now, guys, we are shooting live here at the California Dental Association meeting, and this meeting's a little different this year because it used to be split into 2 regions, and now everyone's coming to one place. It's actually getting pretty busy here. It's a good turnout, and there's deals to be had. And there's a deal here, Dr. James does right now. Now, if you're watching this, you're probably not here. You're not taking advantage of the deal. But I twisted some arms, and we're going to extend this deal here. So what's the deal that for people who want to reach out, they're like, okay, I want to see what you guys can do for SEO.
So our website development deal is 70% off for the development fee. So a normal $5,000 fee is now $1,500, but you do need to mention CDA special.
Here you go. I mean, 70% off. I mean, that's great. But you guys don't do that all the time.
No.
I mean, gosh. And so, and again, if you think about that, $1,500, right? And you think about what your patient acquisition cost is. Actually, the value of a new patient. Let's say you get an emergency patient, right? And they need a limited exam. Let's just say that where you're at, that's like $50. Let's say that they need like some x-rays. That's like another $100, right? And then let's say like they need a root canal crown. You're looking at $2,000, right? And that's off of one patient that you got from the deal with Dr. Genius, right? Just one patient, right? One patient, one emergency patient pretty much covers what they just hooked you up with. And I want to tell you right now, that's not their expectation, is to get you one patient.
No.
Their expectation is to get you way more patients. But here's the thing, full transparency. I mean, they want to continue to work with you guys because what LeBron just said right there, it's going to take multiple times working with your website, growing, stacking like the paper machine, stacking things on top for you to get where you are. And honestly, even if you feel like you got to where you are, you still got to do it. It's like working out. You can't just work out one time. You got to keep working out like forever, right? So again, they understand the value and they want to deliver there. So that is an amazing deal. Ron, thank you so much for joining us here. If they want to say, hey, we want to work, but we want to talk to Ron himself, are you available to talk to him?
I am.
Okay, there you go. Like, look, it's not like the Wizard of Oz where he's behind a curtain and whatever against the CEO. You actually can talk to the man. He just said it himself. So again, for those who are watching this and you want to reach out and you actually want to talk to him too, I think we can make that happen. I think we can talk to him all there.
I think so.
Ron, thank you so much for being on here.
Thank you.